Hi, this is Dr. Amar, Chief Consultant, Laparoendoscopic, Robotic, Bariatric and Metabolic Surgeon from Dr. Amar Bariatric and Metabolic Center, Jubilee Hills, Hyderabad. Today we shall talk about swallowable intragastric balloons which have been recently added to the intragastric balloons. Whether they have any extra advantage compared to regular intragastric balloons, or the companies promoting these swallowable balloons are hiding any information from us. In general, intragastric balloons are indicated for those people who are suffering from obesity and their body mass index is between 27.5 to 32.5 and they are not able to lose weight by lifestyle modifications. They can also be considered for those people whose body mass index is 32.5 and above, who are actually eligible for bariatric surgeries but are afraid to undergo surgeries. These are non-surgical endoscopic methods. Most commonly kept balloons are Orbera intragastric balloon, which has been FDA approved, Orbera 365 balloon. While Orbera balloon is kept for 6 months, Orbera 365 balloon is kept for 1 year. There is another balloon called Spatch adjustable intragastric balloon which can be kept for 1 year. These are regularly used balloons. For all these balloons, we need to do endoscopy and the procedure has to be done under short general anesthesia or sedation. Even during balloon removal, we need to do upper GI endoscopy under short general anesthesia or sedation and balloon has to be removed. Companies who introduced swallowable intragastric balloons, they claim that for this procedure there is no need for endoscopy, there is no need for surgery and there is no need for anesthesia. How far these claims are valid and are there any disadvantages which these companies are hiding? We shall talk about that. For any intragastric balloon insertion, upper gastrointestinal endoscopy is mandatory to rule out any contraindication for balloon insertion such as large hiatal hernias, reflux esophagitis, gastritis and gastric ulcers. Some patients who are suffering from these problems may not have symptoms. Without doing upper gastrointestinal endoscopy, if you introduce balloon, there are chances for complications such as stomach perforation, aggravation of gastritis, aggravation of reflux problems. So, saying that no endoscopy is required before balloon insertion is actually misleading the patients. And no anesthesia is required. Yeah, it is true that to introduce swallowable balloon, you don't require anesthesia. Swallowable intragastric balloon is a pill. You will swallow the balloon and its position is confirmed by using fluoroscopy. Once the position of the balloon is confirmed under fluoroscopy, balloon is filled up to 400 to 550 ml. It is true that anesthesia or sedation is not required for this balloon insertion, but what about radiation? Fluoroscopy is equal to 75 to 3000 chest x-rays. That means to introduce a balloon, you are exposing the patient to unnecessary radiation. This is not revealed by these companies. That means fluoroscopy has a risk of radiation, they won't talk about that. And no surgery is required. Balloon insertion, whether it is a swallowable balloon or any other intragastric balloon, it causes weight loss by food restriction. But the total body fat is controlled by more than 200 hormones which set a value for fat storage. And these hormones are not changed with balloon insertion. So, even if anyone loses weight, once the balloon is removed, 99% of the people will regain weight. So, balloon insertion is always for a temporary weight loss. Surgery cannot be replaced with balloon insertion. Those people who are suffering from severe obesity, especially when the body mass index is 32.5 and above, how many times they try to lose weight, they regain weight because of the effect of hormones. While bariatric surgeries are going to alter these hormones and reset the fat value to a lower level, that's why they induce long-lasting weight loss and long-term remission from type 2 diabetes. Swallowable balloon, if they claim that no surgery is required, for those people whose body mass index is 32.5 and above, balloons will not work for them. Only surgery will work. Those people whose body mass index is less, they don't require surgery. Most of the people require lifestyle modifications. It is not correct to say that no surgery is required. So those people who actually require bariatric surgeries, they may feel that balloons are really helpful, they are going to replace bariatric surgeries. Balloons cannot replace bariatric surgeries because they are very ineffective, very inferior procedures compared to bariatric surgeries. The swallowable intragastric balloons, are they superior to regular intragastric balloons? Regular intragastric balloons, they induce weight loss up to 5 to 10% of the total body weight. This is similar in case of swallowable balloons also. They claim that it is 10 to 15% of the total body weight. That is under test conditions. But when you come to practice, that value will be less. Generally, it will be 5 to 10% of the total body weight. As I told you, balloons will not change the hormones. They mainly cause food restriction. That food restriction depends upon the volume of the balloon. Regular intragastric balloons, we can fill up to 700 to 800 ml. While swallowable balloons, we are keeping up to 400 to 550 ml only. So the size of the balloon is less. So compared to regular intragastric balloons, swallowable intragastric balloons will have less effect. And it also depends upon the duration of keeping balloon. Regular intragastric balloons are kept for 6 months to 1 year, while swallowable balloons, they spontaneously degrade 4 months after balloon insertion. Regular intragastric balloons, once the duration is over, will do endoscopy and remove the balloon, while the swallowable intragastric balloon, it will degrade spontaneously and will pass through. If it doesn't degrade spontaneously, it can block the intestine somewhere. If it blocks, which is a rare complication, we need to do laparoscopy and remove that block. So, overall, intragastric balloons are inferior procedures compared to bariatric surgeries. They cannot replace bariatric surgeries because they don't change any hormones. Average weight loss is 5 to 10% of the total body weight, and once the balloons are removed, weight regain chances are 99%. And balloons have to be combined with lifestyle modifications, and we can add oral semaglutide to maximize the effect of balloons. And swallowable balloons are not more effective compared to regular balloons. In fact, they are less effective. And the advantages which have been claimed by the companies which are manufacturing swallowable intragastric balloons, they are not that true. It is mandatory to do upper gastrointestinal endoscopy before any balloon procedure, and it cannot replace bariatric surgery. And radiation risk is very high because we have to do this procedure under fluoroscopy. If you have any doubts regarding regular intragastric balloons or swallowable intragastric balloons, please do not hesitate to contact me. Thank you very much.